So good morning and welcome to this absolutely fantastic day where we will be focusing on how we can leverage existing platforms in implementing some of the knowledge that we have gleaned around early child development and its integration with health and nutrition services. So this is one of several series of workshops, all of which, as you know from the workshop reports outside, have focused on different things, on the cost of inaction and how to actually proceed in terms of building a coalition around early child development with a community that spans many dimensions. This is a critical year because we have the social sustainable development goals coming up, and the world is going to unite around the SDGs by fall this year. So this is also a great opportunity for us to reach out and see how this fits into the general scheme of things. So without further ado, I'd like to offer the floor to my co-chair, Ann Maston, to take you through the background and some of what we are assembled to do today. Ann.
Well, welcome everybody, both here in person and online, to the Forum on Investing in Young Children globally. We're a collaborative community, multi-sectoral, multidisciplinary, and international, and we are working together along with all of you to ensure that investments in children around the world are a top priority and also informed by science. We share a vision that decision makers around the world will use the best evidence, the best science for investing to optimize the well-being of children and their lifelong potential, which we also believe will optimize the well-being of societies and their futures. There are a number of reasons that this forum is happening now. One, I think, is the growing consensus internationally that it's time to raise the bar for global child well-being, that it's time to go beyond survival to promote thriving and child well-being around the world. There's also exciting new evidence to inform what we do. The science of how early childhood is linked to lifelong health and well-being and future generations is rapidly expanding, and we have more and more evidence on how child development is linked to the health and well-being of societies as a whole. There's also a striking convergence, we think, among many different kinds of stakeholders in the well-being of children. There's great concern about addressing some of the challenges facing children around the world, ranging from the poverty and lack of resources to political violence and displacement that we're seeing at really almost unprecedented levels around the world. And that's coming together as we try to integrate evidence to make good investments in children. This forum was launched in January of 2014, so we're only a little over a year old. And it was launched after a year of very thoughtful planning with support from a number of sponsors. The platform we work from is the U.S. National Academies of Science, and in particular the Institute of Medicine. And this forum is sponsored by two boards at the Institute of Medicine. The Board on Children, Youth, and Families, I'm a member of that board, and Kimber Bogart is the director of that board, and also the Board on Global Health, working together. We have 4 primary objectives. These are always evolving, but this is how we would put them right now. We want to highlight and disseminate an integrated science of healthy child development through age 8, but also integrate how that science predicts the future. We want to identify and share models of program implementation at scale, and also with integrated financing across sectors, across health, education, nutrition, and social protection. And we like to highlight programs that are working in a region when we come to work on a workshop like we are today. Another objective is to identify and catalyze opportunities for intersector coordination at local, national, and global levels, and you're going to hear some great examples of that here today during this workshop. We want to promote a global dialogue on investing in young children, and we're delighted that you're all participating in this dialogue today. We have a number of methods by which we try to promote these objectives. One is by gathering people together for a workshop like this, but also through conversations in person, online, and interactions like these videos that we share on our website. And we also put out reports, both quick, brief reports, and then also longer reports on these various workshops. And these will be coming out in the future from this workshop. You have a jump drive that you can, was presented to you today that has a lot of material for this workshop. And there are also 2 of our workshop reports on the table outside that if you haven't seen a copy, you're welcome to take those. But we have all kinds of things in development. We're working on tools for decision makers, very practical tools so they can use the integrated evidence to improve what's happening in their own region. And we also have all kinds of infographics and other materials that we encourage you to go check out on our website. We're very easy to find. In 2014, we hosted 3 workshops, and we're trying to go all around the world. We started in Washington, D.C., then we moved on to New Delhi, and then on to Brazil. And you can read all about what we gained from those workshops. This Hong Kong workshop is our first workshop of 2015, that later on this summer we'll be going to Ethiopia to work together on supporting family and community investments in young children. And then in the fall we'll go to Prague, Czechoslovakia, to focus on reaching and investing in marginalized children, including refugees, immigrants, and Roma children. We like to think that we are a unique learning community. We aim to be evidence-driven and inclusive and international, to be collaborative and visionary, to be productive, but also practical. And we're delighted that you can join us in this endeavor today and going forward. And now I'm going to turn the platform over to our organizers, our chairs of this workshop. And I believe Albert Lee is going to be next.